Immune disorders are basically caused by a compromised immune system, which can be from illness or from exposure to toxins and chemicals. This causes the body to respond with inflammation, often resulting in short-term as well as long-term symptoms, as well as a general overall lack of health. It can affect any part of the body, but the most common parts affected are the gastrointestinal tract, respiratory tract, skin, and bloodstream. It has been found that the gastrointestinal tract is the one which is generally the most affected by immune disorders, which can lead to such conditions as irritable bowel syndrome and Crohn's disease. Long-term immune disorders can cause such things as cancer, allergies, asthma, fatigue, fever, fibromyalgia, menopause, migraine, urinary tract infections, and autoimmune thyroid disease. There are many different causes of immune disorders, and they include pathogens, chemical toxins, environmental toxins, hormonal changes, and diet. Stress and lack of sleep also contribute to the immune system, as well as a lack of nutrients and vitamins. As mentioned above, it can affect the respiratory tract, which leads to such problems as sore throat, sinusitis, and pneumonia. Chemicals like chlorine and other disinfectants can weaken the immune system, while viruses can cause such conditions as herpes and colds. Although we now know the causes of immune disorders, prevention is always better than cure. Avoid substances which are known to inhibit the immune system, such as organoaldehyde, amyloidosis, and pesticides. Try to avoid long-term stress, and make sure you get plenty of restful sleep each night. Researchers continue to find out how certain genes affect immune disorders in humans. For instance, one rare genetic defect can prevent certain cells protecting the human body from fighting off cancer. Another rare gene may interfere with the natural removal of toxins from the human body. Other genes can also alter the way inflammatory diseases such as arthritis respond to medications. There is still much research to be done, but there is mounting evidence that shows how harmful some of these diseases can be. With all the new information, doctors are taking more notice of this obscure but potentially very powerful weapon. In years past, the best diagnosis for immune disorders was based on history and a physical examination of the patient. This could sometimes produce inaccurate results because the immune system was so strong in some patients and not so effective in others. The advent of molecular biology has resulted in exciting advances in the diagnosis of immune disorders, especially those that involve the immune system. Biopsies taken from cancer patients show how immune cells attack abnormal cells in the blood. These tests have revealed many suppressed immune function disorders such as chronic fatigue syndrome and Crohn's disease. Immune system disorders can affect any part of the body, although they tend to concentrate in the lymphatic system. Common signs and symptoms include unexplained weight loss, anemia, blurred vision, night sweats, fatigue, joint and muscle pain, headaches, and allergic reactions to environmental agents like smoke, pollen, food, and house dust. People with secondary immune disorders may have an overactive immune system and therefore display a series of symptoms that can be confusing and sometimes misleading. Some of the newer immune system test models can rule out more difficult conditions such as chronic diseases or cancer. A recent development in molecular biology has made it possible to quickly and cheaply test for immune disorders using blood samples from patients. These tests are available at many hospitals and medical centers. Because mental health often overlaps with other aspects of wellness, the identification of immune disorders can provide important information about the mental health of individuals. A patient with a suppressed immune system that is causing psychiatric symptoms can benefit from an initial evaluation and diagnostic visit to rule out serious illness like leukemia or a cancerous tumor. This test can alert the healthcare provider to the existence of a suppressed immune system and indicate whether treatment with antibiotics or some other natural remedies should be initiated. It can also lead to earlier detection of psychiatric symptoms that can worsen a situation and make it difficult to control the disease once it has developed. The test can also be helpful in determining if a patient needs to be hospitalized due to continuing complications from untreated autoimmune diseases. In addition to the clinical manifestations of immune disorders, it is also possible to detect the existence of these conditions through non-clinical tests such as blood tests or cultures. When the immune system is inhibited in any way, it reacts to various external stimuli by producing antibodies to fight off the foreign antigens. Abnormal levels of antibody production have been found in people with psychiatric disorders and chronic illnesses. In addition, the antibodies can attack healthy body cells. These abnormal levels of antibody can be detected by lab tests that measure the concentration of antibody in tissues. The symptoms of autoimmune disorders and depression are very similar. They involve depressed mood, anxiety, fatigue, and other similar signs and symptoms. However, depression, which is a normal part of life in chronic depression patients, can be aggravated by these conditions. When the immune system is weak, people are more likely to experience depression, which is a common symptom of many types of diseases. In addition, some of the immune disorders, including inflammatory diseases and allergies, can produce additional symptoms that mimic depression. Eczema and allergic rhinitis are typical inflammatory conditions that can produce extensive dryness and itching. When the immune system is overly sensitive to certain allergens, it can create an environment that allows infection to flourish. If the condition is not treated, it can lead to serious complications, such as sepsis, a life-threatening blood infection. This is one reason that it is so important for individuals with immune system disorders to contact their doctors right away if they start experiencing any of these symptoms. As more is becoming known about how our immune systems affect our bodies, we are learning that it is crucial to control those levels. When the immune system is deficient, we become more prone to infections. When it is compromised, we can experience long-term complications, which can lead to serious health issues and shorten our lives. By learning more about primary immunodeficiency, we can help to ensure that we do everything possible to keep our immune system strong.